Better sleep, sharper focus, a healthier life? It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started. Hey everyone, and welcome back to Still Struggling, the Untethered Airway podcast where we zoom in on all things you were told not to worry about, but maybe you should have, because adult problems, they start out as kid problems every single time. I'm Dr. Meggie Graham. I'm a mom, airway-focused dentist, educator, and a former airway patient myself. And this series, it's here to challenge the they'll grow out of it narrative, because day after day, we hear from families who are still struggling because they were brushed off by providers who missed the signs, or worse, saw them and didn't think that they mattered. Today, we're digging into something so simple on the surface, you might miss it completely, but it changes everything. Open mouth posture. If you've ever heard someone say, "Oh, they just sleep like that, don't worry about it," or "She just breathes through her mouth, no big deal," and you've been told that it's nothing to worry about, or you didn't even know that there was a difference between nasal breathing and mouth breathing, this episode is for you, because the mouth is open for a reason, and the longer we ignore it, the more damage it does. All right, let's start at the top. Mouth posture. What does that actually even mean? It's the way the lips, jaw, and tongue are positioned when the body's at rest. Not chewing, not talking, just hanging out, just resting. Here's what it should look like. Lips are gently closed. Tongue is resting in its entirety on the roof of the mouth or the palate. Breathing is quiet and through the nose. This helps the face grow forward and wide when this is how it is being accomplished in a child. The airway is open and stable. But let's be real, that's not what we're seeing in most kids or adults. I encourage you to just look around at the supermarket or an airport, and you'll be amazed to see how many people are just walking around with their mouths open. We're seeing lips parted, that telltale orange peel chin. That's mentalis strain. So when you see the dimpling on the tongue like that, sometimes it's referred to as orange peel chin, but really what that is the mentalis muscles or the chin muscles are having to overwork in order to get the lips to close. The facial muscles have to keep the lips together, and it's not passive the way it should be. It's a compensation. It's muscle dysfunction. You might see a tongue just kind of laying low in the mouth, kind of lolling about, not toned, just passive and floppy. Lips are chapped and dry. The tongue might have a coating over it. The mouth is dry in general. And somehow we're told that this is totally normal. Let me say this loud and clear. Common is not the same as healthy. Say it with me. Common is not healthy. Even if it seems like it's normal, it's not. And if anyone does mention it, you might hear things like, don't worry about it. It's just how they sleep. They'll grow out of it. It's probably allergies. Nothing to worry about it. No big deal. It is something to worry about, because open mouth posture is the body compensating, and compensation is never neutral. It's your body saying, something's off, but I'm keeping you alive. I've got you. But compensations come at a cost. And before we go any further, you need to hear this. Humans are meant to be nasal breathers. If you're breathing through your mouth when you're not talking or exercising hard, that's a red flag. Full stop. So why is the mouth open? Why would the body ditch its beautifully designed nasal filtration system and say, yep, I'm going to use the emergency hatch instead? Because something is or was blocking airflow through the nose. It could be narrow nasal passages, a deviated nasal septum, chronic congestion and inflammation in the nasal passageways, enlarged turbinates, which are the air filtration system that is in the center of the nose. Maybe the adenoids and tonsils are enlarged or obstructive. The tongue muscle is weak and takes up more space. Maybe there's a tongue tie that holds the tongue down. And all of that probably led to facial growth patterns that set the jaws back too far, constricting the airway. Whatever the root cause, the brain is going to do what it has to do. Survival first, always. So the mouth opens. In that moment of adaptation, it becomes structure and it becomes habitual. Even the original issue, if it's fixed, might not solve the problem because of the muscle memory and habit formation. It's now the new default. This is why behavior change matters. We don't just correct structure or clear the nose. We don't just retrain function, we rebuild patterns. Structure, function, and behavior have to go hand in hand, not only in when we're diagnosing, but when we're offering solutions. There was a 2015 study in Sleep Medicine Reviews that looked at this head on. Mouth breathing in children significantly increases the risk of sleep related breathing disorders, and it changes how the face grows. So, all the things that we say and see clinically has scientific backing. So, yeah, this is not just about dry lips. It's a big deal. Mouth breathing is tied to chronic respiratory illnesses, allergies, asthma, and long term structural problems of the facial head and neck, and actually even body wide because the whole body's connected. It doesn't even stop there. We see the ripple effects. It disrupts sleep, it fragments the sleep cycles, it causes emotional dysregulation, it puts people in fight or flight, it causes attention issues and immune dysfunction. All of it, just because the mouth isn't closed. So let me be super clear. Just because it's everywhere does not mean it's okay. We are in a mouth breathing epidemic, and just because it's common doesn't make it harmless. I cannot stress that enough, and you're going to hear me say that a ton of times because I really want that to sink in. We are met with so many people that just normalize pathology and symptomology because it's so common and because we have so many band aid solutions at our fingertips. Here's what happens when a kid grows up with their mouth constantly open. The jaws grow downward and back. The palate gets high and narrow. The airway gets smaller. The cheeks hollow out. The eyes look droopy. The lips crack. The chin is pulled back. The neck shifts forward in compensation to make breathing easier. This is called long face syndrome, and it's not just a cosmetic or aesthetic issue. The smaller the airway, the harder the body has to fight to breathe. The lower the tongue rests, the more feeding, speech, and sleep are impacted. There was research in the AJODO, that's the American Journal of Orthodontics and Dental Facial Orthopedics, has confirmed this again and again. Mouth breathing changes growth, and those changes don't reverse without intervention. So let's talk about sleep. Open mouth posture doesn't just mess with how you look, it messes with how you recover. Here's why. When you breathe through your mouth, you skip formation of something called nitric oxide. That's a molecule that helps deliver oxygen and keep blood vessels healthy. The only time that we produce nitric oxide is when we breathe through our nose and actually when we hum. But for the sake of this podcast, let's stick to nasal breathing. We have to breathe through our nose in order to make the molecule that helps us distribute oxygen throughout the bloodstream. So, what happens when we don't breathe through our nose and we are breathing through our mouth? We have lower blood oxygen levels. We might have snoring. It could get as bad as the end stage disease of obstructive sleep apnea, which is extremely dangerous. We have more disruptions and fragmentations in our sleep where we're waking up throughout the night, even if we're not aware of those wake ups, which makes us feel really unrested and we're not getting the benefits of the appropriate and necessary sleep cycles. Our sympathetic or fight or flight nervous system goes into overdrive, and that translates to not resting. You're not healing, you're not functioning at your best. So in kids, it causes hyperactivity, but really they're exhausted. Hyperactivity is the compensation to keep them awake during the day because their body is so fatigued. There was another study in 2006. I mean, this research is old. This is nothing new, and yet it's still not common to have providers recite this or know this at the core. In 2006, there was a study in Chest Journal that found that even kids who mouth breathe without full-blown apnea had neurocognitive deficits. So kids that were breathing through their mouth were not developing neurocognitively in an ideal way. This is really a big deal, and yet we're talking about it as no big deal. The whole thing that started me on this path of Still Struggling series was how dismissive providers and big organizations like Children's Wisconsin is when they are faced with patients and parents that are suffering from things that are just being dismissed as no big deal. And it's not new information, it's out there. People just need to recognize it and make it a big deal. So if your kid grinds their teeth, wakes up sweaty, they can't sit still during class, ask yourself, is their mouth open at night? Now, mouth breathing is not the only thing that causes disruption in sleep cycles and causes all these issues. Sometimes kids can have their lips closed and still suffer from all of this, and we can talk about that later. But if their mouth is open, that's a huge red flag. I always tell parents that I don't want to create problems that don't exist, but I certainly want to uncover them if they're there. And when you have enough red flags, the responsible thing to do is identify, is there a reason why they're not sleeping peacefully? Is there a reason why they're not rested? So when you notice this in your child, make notes about it. Pay attention to it because the answer might change everything. Follow your gut instinct because it's probably right. So we zoomed out. Now let's zoom in. Let's look at tongue posture. Where is your tongue right now? Is it hanging out low in your mouth? Or is it gently suctioned in its entirety to the roof of your mouth? Because the tongue, it's not just a muscle, it's a postural guide. Its resting position shapes the upper jaw. It impacts how the teeth come in as they grow in. It impacts how we breathe and how we sleep. When the tongue sits low because of a tongue tie or because of a habit, it can't press into the palate. It can't naturally expand the arch. And guess what? That narrows the nasal space even more. The roof of the mouth is the floor of the nose, it's the same bone. And here's something that most people don't know: the upper jaw is almost done growing by age 6. The maxilla and the mandible reach about 85% of their size by age 5. And by age 7, craniofacial bones are 75% of adult size. Let that sink in. Waiting till age 7 to have to have an evaluation by an orthodontist or somebody that evaluates for crowding of teeth is too late. And that's the current American Academy of Orthodontics recommendation, is to have every kid seen at age 7. And many orthodontists say, come back and see us when all your permanent teeth are in. That's too late when we have so much influence over the way the face grows so much earlier. And we need to understand that the biggest part of our face is the fastest to be done growing. There's even research showing that arch length, or the space needed for adult teeth, doesn't self correct after age 4. So if there's crowding or the baby teeth are touching and there's no spacing and it's not changed before age 4, it's not going to self correct. It's something that will have to have intervention to make enough space for just the teeth. And that's not even taking into consideration oral cavity volume for the tongue, the floor of the nose for nasal breathing. So it's something that has to be addressed and recognized if we're going to prevent it early on. Now, this is not to panic you, because if you've missed this window, it's okay. We have things that we can do, but it's also a huge wake up call to people that if their kids are that young, there are plenty of things that can be done to help shift the needle to a healthier path forward with less intervention. There was also a 2019 paper in the Journal of Oral Rehabilitation, and it highlighted that proper tongue posture and tongue tone are essential to keep the airway open during sleep. And here's a really wild one that I love telling people because it's a really good example of how connected everything is. Prolonged thumb or finger sucking is the way the body tries to self regulate or stimulate the parasympathetic nervous system. And it also helps keep the airway open when the tongue isn't doing its job. So we start it as a compensation in infancy or early childhood, and then it becomes habit. And so it just perpetuates the problem that the tongue can't do its job. How is that for rethinking habits? So, what do you do? If your child has open mouth posture, even if it's not full on Napoleon Dynamite, wide open mouth gaping, it could be problematic. Evaluate nasal breathing. Check to see if they can breathe through their nose. Ask them to keep their mouth closed and time them breathing through their nose. Is it loud? Is it possible? Are they chronically congested? Do they have allergies or swollen tonsils that you can see when they open and say ah? Those are first things that you can do just to see if your noticing anything on your own. Something you can do right off the bat that's seriously not going to hurt and really can help is put a HEPA air filter in their bedroom. If we can decrease inflammatory issues that are caused by environmental allergens, the body doesn't have to work so hard. You can try Buteyko breathing nasal unblocking exercises. There's tons of free resources online that actually work really well. When you follow the instructions, it helps you unblock the nasal passageways and it decreases inflammation and makes nasal breathing easier and more passive. Add nasal saline sprays, just plain old nasal saline that's in an aerosol mister where it's not being blasted into the nose, but really gently introduced into the nose, can be a game changer. And not only when they're sick, make it a daily thing. Brush, floss, rinse the nose. Give it to them in the bathtub and have it become something that's not scary. It's something that can impact their nasal breathing, which can impact their habit. And if you're only doing it when they're sick, it usually has a negative connotation to it. Find the right providers. You want people who understand function, not just structure. You want to make sure that they understand the importance of nasal breathing and they're not dismissive of them having problems and telling you that they're just going to grow out of it. Maybe it's an airway aware ENT, and I promise you they're not all airway aware. A functional dentist, a myofunctional therapist, or a feeding speech therapist focused on the way we function, not just figuring out how to make sounds with compensation. Be wary of anyone who offers a cookie cutter fix. And yes, tongue ties. They can prevent the tongue from resting on the palate, even if nasal breathing is fine. Don't just train the lips shut. If there's no reason to keep the lips closed, they won't stay that way. We need nasal airflow, tongue posture, and oral tone working together. Start as early as you can, but again, don't panic if your child is older than 7, 8, 9. We can jump in and intervene whenever we notice that there is an issue. So the earlier we start, the earlier we guide growth and function, the easier it is to redirect, but it's never too late. It does get harder though. Compensations get more complicated, symptoms get louder, intervention gets bigger. My final thoughts, I want to wrap this up. Open mouth posture is not a cute little habit. It's not just how they sleep. It's a signal. It's a red flag and it should be addressed. The body is saying, I cannot breathe through my nose. I'm doing what I have to do to survive. But you can change that story. By restoring nasal breathing, supporting tongue posture, and guiding growth, you're not just improving posture. You're improving sleep, behavior, immune health, focus, confidence, whole body function. It's such a big deal, even though it can look really simplistic at the surface. I'm Dr. Meggie Graham. Thanks for being here with me on Still Struggling. Next time, we're diving into nighttime grinding, why it's not just about stress, and what it tells us about oxygen, reflexes, and survival mode. Until then, keep asking better questions, keep looking closer, and keep showing up. Thank you for joining us on the No One Told Me, the Airway Health Connection, the Untethered Way.
We hope you're leaving with new insights and feeling empowered to take charge of your airway health.
If you enjoyed this episode, be sure to subscribe and share it with anyone and everyone who needs to hear it.
To learn more or get in touch, visit us online at untetheradairwayhealthcenter.com.
Remember that when you breathe better, you live better.